Here in a Fresno State biology lab, students are researching a bacterium closely related to the one this campus had a scare with, tuberculosis. Senior biology student Alicia Remlin is one of the lab's researchers. Her job is to identify the genes responsible for oxidative stress, which is essentially finding cells that will help kill the bacterium.
This is where it relates to tuberculosis. So Mycobacterium smegmatis is the model organism for Mycobacterium tuberculosis. Except that it's not a pathogenic organism, so it allows us to be very loose about it. We don't have to work in the hood so much.
This allows the students to be freer with handling the bacterium specimen, and they don't have to have extremely secure conditions. Biology professor and microbiologist Mamta Rawit said what studying the bacterium can do.
The work we do on Mycobacterium smegmatis tells us about the biochemistry of Mycobacterium tuberculosis. So we can make inferences from our research on Mycobacterium smegmatis about Mycobacterium tuberculosis.
And the research is paying off. Dr. Rawit let us know this lab's findings.
We're studying particular pathways, and we've identified certain drug targets. So once you identify a drug target, then you screen for drugs that stop that drug target and kill the bacterium.
Concerning the outbreak at Fresno State, Dr. Rawit knows of just one person with active TB. There may be students who have TB but do not show symptoms, according to Rawit.
They test positive, and so they have what is called latent tuberculosis. And so there might be 1/3 of the student population here who have latent tuberculosis. They don't have active disease.
There is an effective way for students to avoid contracting the disease.
But if they're immunocompromised, if they're unhealthy, if they have HIV, then chances are that they will get active disease. So the best prevention is to have a healthy lifestyle.
Physician at Fresno State's Health Center and Medical Chief of Staff Dr. Dan Little said that tuberculosis and Ebola are not as likely to spread at Fresno State.
Both tuberculosis and Ebola are very rare. As we know, as of this point, there has only been just a few cases of Ebola. Those have all come from people who have either traveled from West Africa or have had direct contact with somebody who is sick from Ebola. So Ebola is very unlikely to affect our campus.
So because these diseases are not very likely to spread like influenza is, according to Dr. Little, how does he think the Ebola cases in America are being handled?
I think the Ebola issue is twofold. One, there is no known treatment for it at this point, so that always raises fear. And then it is just it's something of an exotic disease, so it's I think just more interesting than influenza that you hear about every year.
If an Ebola outbreak ever did occur, Dr. Little said he thinks Fresno is prepared, and so is Fresno State.
On training with our staff here, we've worked with others on campus to make sure that we take appropriate precautions to identify and isolate that person, and then contact the appropriate authorities from the county health department and others to make sure the patient got treated appropriately.
Dr. Little said there are certain protocols the health center would follow depending on how the disease is spread.
Tuberculosis is also spread by infected person coughing and others coming in contact with little droplets. Tuberculosis is much more difficult to contract. You have to be in a fairly confined airspace for a significant length of time.
And to contract Ebola?
Ebola is different in that it is contracted more by direct contact. You need to come in direct contact either with the skin, blood, or body fluids of somebody who is infected with the Ebola virus.
The protocol the Students' Health Center would follow would be?
And so we have protocols in place that would help us identify the patient and then help take the appropriate steps. If it's an airborne disease, then it's more putting masks on and isolating that person. If it's a contact disease, then it's more using gloves and those types of things to help prevent the spread.
With more awareness and even Ebola medications going up in stock, according to the New York Times, Dr. Little thinks the nation is going through appropriate precautions, but is glad to hear from leading health authorities.
Some of the nation's health experts trying to put the Ebola outbreak in perspective, that we have had just a few people diagnosed in this country, and emphasizing that people are much more likely to be affected by influenza or other diseases.
Doctors like Dan Little seem pretty confident about the spread of Ebola, tuberculosis, influenza not to be a big outbreak in Fresno and on the Fresno State campus. But do Fresno State students
students feel just as confident? Let's find out from some of them.
Sophomore biology student Maxwell Hill is more concerned about Ebola and less about tuberculosis.
One or two of the nurses who had worked on the patient in Dallas had been allowed to go on a plane and had been found to be sick. So now that it's left Dallas, who knows where it could spread. So some of my friends are worried about that. I am a little bit too, admittedly.
I wasn't being too cautious about it. I mean, I washed my hands and stuff, but it's one person out of a really, really big school. And as long as I stayed away from anyone with that kind of contact, I'm sure we would be fine.
Vargas said her peers reacted a little differently.
I mean, some of my friends are kind of concerned. There's not really like a big thing. I mean, a lot of people are just putting it on Twitter and teasing about it, not really taking it serious as they should.
The TB, it kind of did scare me for a bit, but then I kind of figured Fresno State, they're going to take all the precautions they can to make sure we're okay, so I'm fine with that.
Vu said her friend was bothered because more preventative measures were taken for the Texas nurse versus the average citizens who contracted the disease.
Just upsetting to her to know that they would do everything they can for a nurse but not a regular person.
Are these students getting their flu shots?
I do. I usually do that every year, yeah.
I try to make sure I eat healthy and stay healthy and do everything I can to not get sick. And I normally don't get sick, so I figured I don't need a flu shot.
I probably am, just to put my mom's mind at peace.
Flu shots are available in the Student Health Center upon appointment. The center sent out a memo saying the shots are free to Fresno State students while supplies last. Jodi Parkinson, The Collegian.